And I was a practicing cardiovascular and thoracic surgeon for 15 years prior to coming to Congress. So, first of all, I'd like to say I'm grateful to be on the committee and on the subcommittee and discuss this very important topic. Briefly, I'm going to comment on another thing that we're not really talking about today, but to help Medicare program is to really get overall health care costs going, bending the cost curve, price transparency, quality transparency, work towards a more market-driven economy in health care versus a price-fixed economy. Of course, tort reform to decrease the cost of defensive medicine, among many others. Coordination of care is very important, including coordinating medical records, electronic medical records, to be able to communicate with each other. This is a significant problem even within my own community. With that, Dr. Rivlin, in Senator Lieberman's testimony, he states that if we do nothing, the Medicare Hospital Insurance Trust Fund will become insolvent at some point in the next decade. That means it will have exhausted its reserves and will pay out more in claims than it receives in taxes. As a former CBO director, how real do you take this threat if Congress fails to act to improve the financing of the Medicare program?
Oh, it's very real. Now, there isn't an exact drop-dead date. We change that estimate every year depending on how rapidly costs are going up. But it is clear that on almost any trajectory you can imagine, that we will not have enough revenues coming in to support the current program for beneficiaries. Now, that doesn't tell you what to do about it, but it's a real problem.
And what might be the result of that? I mean, to seniors say that did happen the next day. I mean, what would happen with what would be necessary with the program if we didn't change it and it got to that point?
Well, you're assuming the Congress doesn't do anything. The Congress would do something, but it would be more expensive to wait than to gradually phase in the kinds of reforms that we've been talking about today, which we all hope will make the health system more efficient and give the beneficiaries of Medicare better care for less money or less rapidly increasing costs.
Okay. The Congressional Research Service, in a memo dated April 16, 2012, opined on what would happen should Congress fail to address the coming bankruptcy or insolvency date of the Medicare Hospital Insurance Trust Fund. And I quote, "There are no provisions in the Social Security Act that govern what would happen if insolvency were to occur. For example, there is no authority in the law for the program to use general revenue to fund hospital services in the event of a shortfall. Plainly put, Medicare is not authorized to pick which claims to pay and which not to pay in the event the program no longer has funds to cover overall costs." Senator Lieberman, on that point, which I think is very important, if we do nothing, the Medicare Hospital Insurance Trust Fund will become insolvent. The Congressional Research Service says that there's no authority for Medicare to pay hospital claims in the event the program does go insolvent. I think you'll probably agree with Dr. Rivlin, the problem is real, but how might this impact, if there isn't action, how might this impact access to health care for senior citizens?
Thanks, Doctor. Well, the problem obviously is real statistically, as Dr. Rivlin said, under almost any imaginable set of scenarios. I mean, this prospect now, and Dr. Rivlin's probably right. In an atmosphere as we got up to midnight, and it looked like the Hospital Insurance Trust Fund was going bankrupt, Congress would probably come in and fix it. But you just think about the instability that would cause in our healthcare system, and the high anxiety it will cause among seniors. So this is a question of whether, like so many, whether Congress, the executive, work together to solve a problem before it becomes a crisis or a catastrophe, because inevitably that's what's going to happen. I mean, people have spoken today. I respect them. Obviously, to fix this, you've got to ask people to do things they don't want to do. Dr. Coburn and I think, came up with a proposal that was ultimately pretty progressive and tried to share the responsibility for avoiding the catastrophe that you describe. But if that catastrophe was not on the horizon, of course, none of us would do any of this. We just keep going along. But that's, putting our heads in the sand, and that's not what I know any of you came here to do.
Yeah, and I think we can make the case for incremental reform, and the SGR proposal may be a great opportunity. I yield back.